Been known to cause serious health problems like heart attacks and diabetes.
Researchers have found a more dangerous effect to your mental health, especially if you are not vaccinated. Wing News Health and Medical reporter Amy Osher has details.
When you think of the effects of COVID-19 or long COVID, you think of this. But what about your mental health?
So it's really the neurologic manifestations that we've been able to characterize following SARS-CoV-2 infection that fall under the umbrella of long COVID are much wider in scope than just brain fog that most people talk about.
Studies find people who had COVID are much more likely to have incidents of depression, anxiety, sleep disorders, opioid use disorders, and other substance abuse disorders. But do vaccines help?
Vaccine reduces the risk but does not eliminate the risk of these manifestations.
Unvaccinated people who were hospitalized due to COVID were over 15 times more likely to have an incident of depression compared to over 12 times for vaccinated hospitalized people.
You can think of it as when the tsunami hits and the water recedes, or when the earthquake stops or the earth stops shaking, you're going to be left with the damage.
It's a personal choice, but people need to be aware of the risks when they make that choice. Amy Osher, Wink News.
Amy, thanks. A new study on long COVID finds 3 years after infection, people who were not hospitalized no longer have a higher risk of death. However, people who were hospitalized still have a higher risk of death even after 3 years.